Hi, I'm Maral, psychotherapist, hypnotherapist and founder of Clarity Flow Hypnotherapy, where we practice only the very best kind of solution-focused clinical hypnotherapy. Today I'm going to answer a couple of questions about solution-focused clinical hypnotherapy. Firstly, what it is and why it's such a good option for so many people and all sorts of conditions. So first of all, let's delve into what exactly is meant by solution-focused clinical hypnotherapy. Now, solution-focused hypnotherapy is a type of psychotherapy. That means therapy that uses psychological rather than medical means to help people. More specifically, it's a type of psychotherapy that uses clinical hypnosis as the main but not only tool in the therapist's toolkit. And hypnosis is used because it's an excellent, comfortable and easy way to help a person access the power of their own mind. And by doing so, that person can sort through and clear many things much quicker than using some other methods and tools. The tool of hypnosis being used in this way is what earns it the clinical title. And it's quite different in many ways to stage hypnosis used for entertainment purposes. So that explains the clinical hypnotherapy part. The solution-focused part refers to a branch of psychotherapy called solution-focused brief therapy, SFBT, which has a couple of important characteristics. It focuses on the solution and not the problem, so there is no digging deep into the past, rather sessions are spent using the power of the mind to come up with solutions in the present. Another central element is that it utilises each person's own resources to construct a clear vision of their preferred future, so it's non-prescriptive and very personalised. Ultimately, it's all about seeing functional, positive change in our everyday lives, which is what most of us want and need, isn't it? Also, very importantly, it's heavily based on the latest research in neuroscience, so it has a very strong scientific foundation. In fact, studies in neuroscience show overwhelmingly that the answer to increased coping and improved well-being are found in our understanding of certain brain functions. So solution-focused therapy is about first understanding and then utilising these natural functions that we all have. And thanks to the plasticity of the brain, a concept I'll come back to in a minute, we can all change our thoughts and habits relatively quickly and effectively, relative to other types of therapy, that is. In fact, a study looking at the overall lasting success of various psychological approaches conducted by the prestigious clinical psychologist Dr. Alfred A. Barrios found hypnotherapy to have a 93% success rate after only 6 sessions, compared to behavioural therapy, which had 72% success rate after 22 sessions, and ordinary psychotherapy only 38% success rate after 600 sessions. You can see, far from it being some airy-fairy, wishy-washy, look into my eyes and magic happens sort of thing, solution-focused clinical hypnotherapy is evidence-based and has a huge success rate. Now, coming back to the plasticity of the brain, research has shown that far from being hardwired, the brain is constantly being rewired and new neural pathways can develop and become established within 45 days. So the timeframes previously thought to be needed for effective therapy have been reassessed, and based on this fact and on clinical evidence, we can be confident that brief therapy done the right way is effective and lasting. Now, I often say, as lovely as the people I see may be, and they are, I don't expect to see people back anytime soon once we decide to finish. Because once we're done, I know that they know how to keep themselves in a good place. And this is another great thing about solution-focused clinical hypnotherapy, that the aim is to learn how to stay well without a long-term therapist, because once you know how your brain works and how and you have some practice at how you can help yourself make real changes for your own good, it's actually quite difficult to go backwards. In a way, you'd be right to think that solution-focused clinical hypnotherapy isn't only a therapy but an education. I think we would all have been very grateful had we been taught some of these brain facts and tools at school. instead of having to wait until we need a therapist, finding a solution-focused clinical hypnotherapist to find out these valuable bits of information. So I think the facts speak for themselves in answering why solution-focused clinical hypnotherapy is such a good option. As I said, there's no magic, though results can sometimes seem magical because all sorts of things get better for all sorts of different people, but it's really just about a person being dedicated to making changes for the better and committing to the process. And the great news is that it's easy. In fact, nothing could be much easier than enjoying a hypnotherapy session. You can find me and lots of information, including a list of issues hypnotherapy can help with, at www.clarityflowhypnotherapy.com. So stay well, and if you're struggling, don't suffer alone. See me. It will do you good, and we all deserve to be well.